Assalamu alaikum. Hi everyone. Today we will study Rubella virus, which is also called the German measles. Rubella is usually mild viral disease in children and adults. However, it becomes very dangerous if a woman is infected during the early pregnancy stage because it can cause a severe birth defect in the baby. This condition is called congenital Rubella syndrome. In this lecture, we will discuss the virus structure, replication, disease process, laboratory diagnosis, interpretation of result, prevention, and vaccination. Let us start by give you the learning objective of this lecture. By the end of this lecture, we should be able to first describe the structure and genome of the Rubella virus. Second, explain how the viruses cause the disease in the adults and in unborn babies. Third, you can be able to do the correct laboratory samples and the best diagnostic tests. Fourth, you can be able to correctly interpret the laboratory results such as the IgM or IgG or IgG, the avidity and the real-time PCR. Fifth, you can able to recognize the false positive laboratory result and know when confirmatory testing is needed. Finally, you will be able to understand the prevention and biosafety and the important role of medical laboratory in controlling the Rubella infection. Let us start to give you a historical background of this virus. The disease was first described in Europe during the 19th century. A major discovery is happened in 1941 when the Australian eye specialist called Norman noticed that many babies born with a cataract had a mother who had the rubella during the pregnancy. This proved that, show that the rubella can cross the placenta and damage the developing fetus. The virus was successfully isolated in the early 1960s in the cell culture. In 1969, the first rubella vaccine became available. Then in 1971, the combined MMR vaccine, which includes the measles, mumps, and rubella, was introduced. Vaccination had a greater role in the reduced rubella cases and congenital rubella syndrome around the world after introduce the vaccine in the vaccination programs in different countries. Classification and taxonomy of the Rubella virus. Rubella previously classified it under the family Tobophyridae, but now in 2018, International Committee Taxonomy of Virus moved this virus under the family Montoviridae and the genus Robaviruses, species Rubella robaviruses. This virus is different from the alpha viruses in the viral structure and replication strategy. Have only one serotype when the human are the only natural reservoir. For that is easy is the only reservoir. For that, when the human are only the natural reservoir, the vaccination can be the vaccination is coverage high percentage of the prevention of the disease. This virus can be potentially eliminated because it have one serotype. Viral structure and morphology. The rubella is a small involved virus measuring about 50 to 70 nanometers. The involved is made from the host membrane, so it is easily destroyed by the heat, detergents, alcohol, and drying. Inside the involved is an icosahedral capsid which protects the RNA viral. On the surface of this involved, there are two important glycoproteins which we call it E1 and E2. This protein help the virus to attach to the host and enter them inside the cell. And E protein is the important glycoprotein. Why? Because it is stimulated neutralizing antibody after infection or vaccination. Because the virus has an evolve, it does not survive long outside the body, making a close respiratory contact the main route of transmission. Now look at the genome organization of the rubella. Rubella virus has a single strand positive RNA genome, which means its RNA can directly act as a messenger RNA and be translated by the host cell immediately after infection. The genome end at 5 end, which is called the cap structure. At the third end, there is a poly A tail. This feature of this RNA make the viral RNA very simple or similar to the human messenger RNA, and this help with the protein synthesis and stability. The genome of the rubella contains two open reading frames, which is called ORF1 and the ORF2. The first open reading frame, ORF1, is located at the 5 end. It produces a large non-structured glycoprotein, which is called B90. This is a polyprotein is later divided into proteins that are responsible for the viral RNA replication. The second open reading frame, and here OFR2, is located at the third end. It coded a structural protein, polyprotein called the B150. This protein, or this precursor of the protein, is proceed into the structural proteins of the virus, which produce a capsid protein C, اللي هي surround the viral RNA, involved glycoprotein E2, which help the virus to attach the host cell, and then involved glycoprotein E1, which is mediated for membrane fusion, and this is the major target for neutralizing antibody. So the genome of the virus contain an ORF1, which produce the replication protein, while an ORF2 produce the structural protein needed to assemble a new virus pattern. This organization of this genome helps the virus to eventually control its replication and assembly in the host. Here we talk about structure and non-structural protein. The virus produces two groups of protein, structural protein and non-structural protein. The structural protein become a part of the virus particle itself. First, a capsid or a C protein surrounded and protected RNA viral. And the glycoprotein is the most important surface protein, help a virus fuse with the host cell, and is the main target for neutralizing antibody after infection or vaccination. Other structural protein, اللي هو E2 glycoprotein, helps the virus to attach a host cell, and also it is so important for infected. And E3 protein is involved during the virus maturation and release from the host cell. And non-structural protein are responsible for the virus replication. We have many non-structural protein, the B90, والmethyl gynotransferase domain, والprotease domain, والhelicase domain. This non-structural protein include the RNA-dependent RNA polymerase, which is copies the viral RNA. The other enzymes which included in non-structural protein help to make an RNA cap and cut a protein, viral protein into their active form, and unwind RNA during replication, so that the structural protein build the virus and the non-structural protein help the virus to multiply. يبقى non-structural protein هي مهمة للفيروس في replication. Replication cycle of a rubella. Rubella virus replicated in the cytoplasm of the host cell. The first step is the attachment, E protein and E1 protein bind to the receptor on the host cell surface. Next, the virus enters the cell through an endocytosis. Inside the enzymes, the acidic environment causes the viral involved of fuse with the endosomal membrane, releasing of a viral RNA into the cytoplasm. Because the genome of rubella is a positive sense RNA, this genome acts directly as a messenger RNA. The host ribosomal immediately translated the viral RNA to produce a non-structural protein, while viral polymerase then make a negative RNA template, which used to produce a new positive RNA genome. There are shorter subgenomic produced during a replication, which is called 24S. This 24S subgenomic RNA will produce a structural protein, which you need to building up aliphases. The capsid assembly after that, then the last stage, the capsid assembly around the new RNA, while an E1 and E2 protein are inserted into glycan membranes. Finally, new virus particle bud into the glycogen, mature and leave the cell by an exocytosis. That means the virus replicate occur in the plasma, intercell by endocytosis, and released from the cell by exocytosis. How a rubella virus can cause a disease? There are two types of mechanism of the disease of rubella. One type is called acquired infection, and the second mechanism is congenital infection. Congenital infection, that means it related from transmits the infection from mother to baby. Acquired infection, that means the infection transported by respiratory droplet. Let's talk about the direct infection. A rubella infection usually started infection when the person inhales respiratory droplets from an infected individual. A virus multiply in another pharynx and all near lymph node, replicate in it. Then the virus enter a bloodstream. In this point is called the primary variant. After more replication, a virus enters the blood again and causes secondary viremia, allowing the virus to spread throughout the body. When the immune system is begin fighting the viruses, the typical begin rash appear. يبقى الراش يصير علينا في السكين بتيجي عليه الرياكشن بتاع immune system when to start to fighting this virus. People are contagious from about 1 week before the rash until the 1 week after it is appear. During a pregnancy, the virus can cross the placenta and infect others. It damages rapidly and dividing fetal cell, slowing their growth of the fetus and interfering with the normal organ development, because the fetal immune system in this stage is immature. The virus may be resist for many months after birth. This is why babies with a congenital rubella can continue shedding the virus for a long time. يبقى في congenital infection virus transmitted from mother to baby through placenta. After that, the virus infected the fetal endothelium and different organs, causes damage to divine fetal cell and the slow growth of the virus, interfering with the normal organ development, which lead to congenital abnormalities. Transmission and global burden. Rubella is spread mainly through respiratory droplets when an infected person cough or sneezes. This is the primary placenta, and here maternal viremia is way of the transmission from mothers to fetus. also rubella is less contagious than measles لأن rubella اللي هي الكونتاجيوس بتاعتها less than the measles. It is spread easily among the people who have a close contact. Need a close contact with attention to transmitted this virus, such in school and the household. Patients are infectious from about 7 days before the rash appearing and until 7 days after a rash appears. Babies with a congenital rubella syndrome are especially important. Babies who have a congenital rubella syndrome عنده أهمية ليه؟ because they can shed the virus, because it can shed or excrete the virus in the urine and the respiratory secretion for above to 1 year. Before the vaccination program introduced the vaccination of the rubella caused more than 100,000 babies worldwide each year can be born with a congenital rubella syndrome. Today, vaccination has greater reduced in this disease, but the outbreak is still occur in the countries where vaccination coverage is low. WHO target that rubella elimination in all regions in the incoming years. Incubation and infection period. After exposure to the virus incubation period of about 12 to 23 days with average is 14 days. During this time, the infected person usually had no symptoms. Around 1 week later, the virus entered the bloodstream, the first viremia and the mild symptoms may appear. Rash usually appear after around 14 to 17 days and last for about 3 days. Patient in this stage is infectious, but infectious starts before rash appear and shortly after a rash disappear. For congenital rubella syndrome, an infected infant can continue shedding a virus for the 1 year following. For that, the healthcare worker should use operated infection control measure when caring of this infant who infected by a congenital rubella syndrome. Here is the clinical feature of acquired rubella. The rubella usually mild, especially in the children. Some infected people may have a very mild symptoms or no symptoms at all. Illness usually begin with a low-grade fever, headache, and sometimes redness of the eye. Once the earliest sign is slow, the first sign is low in lymph nodes, especially behind the ear, or back of the head, and in the neck. These enlarged lymph nodes often appear before the rash and are an important feature for the diagnosis of this infection. The rash is fine big rashes that start from on the face, spread downward to the neck, trunk, arm, and leg. Rash usually lasted about 3 days. So rubella is sometimes called the 3 days measles. What is the 3 days measles? Is the rubella or a German measles. Unlike a measles, rubella patients usually have a lower fever and milder symptoms. Complication of the acquired infection, the most complication is arthritis or joint pain, especially in the adult woman. Thrombocytopenia purple, where a platelet count fell leading to easy bleeding. Also, there is a complication, but the serious complication may be when a virus reaches the brain and causes encephalitis, inflammation of the brain. Admission may develop confusion, cirrhosis, and coma. Very rare rubella causes nervous inflammation or condition similar to Guillain-Barré syndrome. The serious complication of rubella infection is uncommon, not like measles, but they should always be recognized when it starts. Congenital rubella syndrome اللي هي عبارة عن شنو؟ هي this is one most important illness of the rubella and dangerous for the fetus. When the rubella virus infect the pregnant woman during the first trimester of the pregnancy, this is very dangerous. Why? Because the mother in this stage can be transmitted an infection to a baby. When a virus enters a fetus in the pregnant woman, the 90% chance of developing a serious birth defects. Between 13 to 16 weeks, the risk when the pregnant woman infected is between the 13 and 16 weeks, the risk decrease, but it is still significant. After 20 weeks of the pregnancy stage, the risk of major congenital defects becomes very low. For that, it is important to determine what the time of the infection of the pregnant woman. It is the first or in the second trimester or the third trimester. During an early pregnancy and baby's organs are forming. If a virus infects the fetus during this period, it can lead to damage of the eye and ear and heart and brain and other organ. This is one of the most complication of the rubella virus cause infection to a neonate. The clinical features of a rubella can cause infection to الeye اللي هي cataracts للنيونات, oral cardiac infection, oral ear infection leading to hair lossing, or can cause complication or neurological اللي هي developmental delay in the neonate. Other can be causes thrombocytopenia, also can be one causes to lead of one of the autoimmune disease developed during the life of the fetus اللي هي diabetes mellitus type 1 or hyperthyroidism or progressive panencephalitis, which is very rare complication of the rubella infection. A host immune response look at how the immune system responds to the rubella infection. The first antibody produced in the rubella infection is the IgM. IgM usually appear about 5 days after the rash reach the highest level within the 1 to 3 weeks and then gradually disappear over the next several weeks. Next antibodies the body produce IgG antibodies. IgG remain for a lifelong and provide long-term protection after a natural vaccination or a natural infection. The E1 protein is the most important protein because it target for the immune system which produce protective antibody against this antigen. During a pregnancy, material IgG can cross the placenta and protect the baby from the infection. However, IgM does not cross a placenta because it's a large size. Therefore, if a newborn has a rubella specific IgM, that means the baby produces antibody confirming a congenital rubella infection. The last type of the immune system produced is the T cell mediated T cell, which help to eliminate a virus infected cell. In congenital infection, fetal immune system in the congenital infection where the fetal immune system is immature, allowing the virus resist and be shed for the many years after the birth because the immune system is not developed for the neonate. How we diagnose? There are 4 main diagnostic methods for the rubella. First, serology, which detects the IgG or IgM. Second, detect the IgG avidity, which help determine whether the infection is a recent or occurred in the past time. The third technique, we can use a PCR, which detects the viral RNA directly and is especially useful for the early infection. Fourth is the viral structure, but now it is not used, it's used for the research and the vaccination only. The sample which is used for the diagnosis of a rubella depending on the patient condition. When we use a serological test, we can use a serum. When for molecular technique, we can use a throat swab and the urine swab, especially during the first week after the RAS appear. For the baby suspected of congenital rubella syndrome, we take a throat swab and urine for diagnosis by what? By PCR. Because infant should the virus for several months, and we cannot do serological test because the antibody is not produced from the baby. Always collect the samples early and in suitable time and transport it under temperature under suitable conditions اللي هي temperature 2 to 8 or storage for in the freezing. Recommended a cold chain condition for the storage of the samples. Okay. IgM and IgG detection. Serology is the most commonly used test in the laboratory for diagnosis of a rubella in the different patients. Let's start with an IgM. Rubella specific IgM appear about 5 days after the rash begins. A positive IgM usually suggests that is a recent infection. If a blood sample is collected too early and the IgM may still be negative, that means immunity will not develop until now. In this situation, we repeated the test after 5 to 7 days after the rash appeared. Also remember that IgM can sometimes give false positive result due to the infection, such as other cross-section with the other virus like Alporoviruses B19 or Epstein-Barr viruses or a rheumatoid factor. Let's now to talk about the IgG. Positive IgG usually mean that the person had immunity from either previous infection or vaccination. If we take a seroconversion serum and test the IgG 2 times, first test IgG is negative and the second IgG is become positive, that is confirmed this is a recent infection. If an IgG is absent, is negative, the person is considered susceptible to the rubella infection. The IgG ability interpretation pitfalls. This slide explains IgG ability, which is especially important during the pregnancy infected. And ability means strongly IgG antibody binding to the virus as general. Immediately after a new infection, the antibodies bind weak to the virus. This is what we call it low ability virus. Antibody in the first infection is bind weakly to the virus. This is called it what low ability. Over the next few months, our antibody mature and bind much strongly to the virus. This is what we call it the high ability. So, if a pregnant woman has a positive IgM, if we test a pregnant woman by the serum and detect that IgM is a positive, and the low ability IgG, that means it is the primary or recent infection of a rubella, which may put the fetus at the risk. If a pregnant woman has a high ability IgG, an infection occurred in the past or several months early before the pregnancy, so the fetus is usually not at risk. Usually, interpret the IgM together with the IgG ability and the patient clinical history and the vaccine history. When the result is unclear of the IgM and the IgG ability, we use the PCR to confirm this result. Molecular and PCR. The PCR is the most selective method for detecting of a rubella virus itself. Instead, we're looking for the antibody. The PCR is detect the RNA virus. This test work best during the first week after the rash appear, when the amount of the virus is the highest. For congenital rubella syndrome, testing both throat and urine samples gives the best detection rate, especially during the first 3 months of the life of the neonate. Real-time PCR is suitable because it's rapid, highly sensitive, and highly specific. Also can identify a virus genotype by a molecular technique by PCR, which help a public health uh, investigate the outbreak and monitor the virus transmission. But put in your mind that a negative PCR does not completely rule out an infection, especially if the samples was collected too late or handled improperly. You need to repeat the test. Virus structure, viral culture, and isolation. Viral culture was once of the standard method for diagnosing of rubella in the past, but today it is not used. Usually it used in the reference laboratory for the research and for the vaccination, or the virus can grow in different cell lines such as the vero cell, BK13, BHK21, primary African green monkey kidney. This is all type of the cell line can be used for the culturing of a rubella. Rubella virus, unlike other viruses, rubella cannot able to produce cytopathic effect. It produces very little visible damage to the culturing cell. For that, laboratory may need additional tests such as immunofluorescence or a real-time PCR to confirm that the virus is growing in this cell culture. Compare between the PCR and viral. Viral is slow, less sensitive, and need more lower intensity, while PCR is quickly and more sensitive and more specific and used for genotyping and can be genotyping the what help in genotyping of the virus. But the culture can be used for genotyping, surveillance, and research. Since live virus is handled, all worker laboratory or research should be performed using a biosafety level 2, practiced by trained laboratory personnel. Here, diagnostic organisms, the slides show the laboratory approach to the different clinical situations. First, for the suspected rubella and pregnancy exposure and suspected congenital rubella syndrome. For suspected acute rubella, we tested an IgM. If negative or high suspicion repeated after 5 to 7 days, also we tested an IgG, acute convalescent seroconversion. Also we can test it by PCR on the throat swab or urine. For the pregnancy woman, we tested an IgG or IgM baseline. If an IgG also we tested ال IgG avidity اللي هي IgG avidity وال IgM وinterpret the result together and confirm by the user PCR. Suspected neonate اللي هي congenital rubella syndrome, we can test the neonate for the IgM. Also we can test it urine throat swab by a PCR and follow IgG up more than 6 months. Isolated an infant when it is found it is positive and reported to public health to control the infection. Prenatal and neonatal diagnosis. Here في البريناتال usually we tested the maternal IgM with low avidity IgG recent primary infection, a fetal sample or a neonate sample, a PCR on the amniotic fluid, or a prenatal PCR on a chronic vela reported in the research setting. They applied in the research setting for the diagnosis of fetal blood IgM possible, but technically demanding a higher risk because a fetus when it is born the immune system is immature above to 6 months. Neonatal congenital rubella syndrome, we can test it IgM in the cord. Also we can test it PCR respiratory secretion. While IgG it is found more than until 6 months of the infection. The suspected congenital rubella syndrome documented to maternal vaccination history to the doctor. This is example of the case to interpretation the result of the laboratory. This is a woman, 6 years woman, 9 week gestation, developed a faint rash on the skin and theoretical lymphadenopathy. Rubella IgM positive, while IgG is positive with low avidity. الBCR, we do PCR on the throat swab which is positive. She is unsure of vaccination status. هي متأكدة من الوضع بتاع الفاكسين حقها. The interpretation of result for this patient is the primary infection. Why? Because the IgM is positive هو ال IgG low avidity. This is indicate is a primary infection. Risk of fetus, there is high risk of the fetus because it is infection in the first trimester of the infection. The next step after that, we need to specialized fetal medicine referral to different consultant to follow up this fetus in the uterus of the mother. اللاب رول دور اللاب هنا هيكون شنو؟ هيكون هنا accurate reporting and coordinated confirmatory testing with the reference lab to confirm the result of this pregnant woman. Differential diagnosis of a rubella like rash can very difficult to differentiate it to rubella by the rash of the skin because there are many viruses cause the rash on the skin like measles, paravirus, B19, enterovirus, herpes type 6, and the drug reaction and the dengue fever and other. All these viruses cause rash, but for that is very difficult to confirm to diagnose the patient clinically according to rash. We need to another laboratory test to confirm this infection. The treatment and clinical management. Accurate rubella not need antiviral therapy, need only supportive care. Isolate the patient for 7 days after rash onset. Management atorphopathy. Systematically, any symptoms can be controlled. The pregnant woman contact any pregnant woman contact to patient infected by the rubella. We assessment serologically and counseling. في congenital rubella for a neonate, this is a multi-discipline follow up اللي هي different اللي هي radiology and ophthalmology. Radiology, all of them is follow up the fetus in the uterus of the pregnant woman. Contact isolation until no longer infectious, and early hearing intervention, and also assess the cardiac to assess is there a defect or not. Long-term surveillance, usually a baby after follow up the baby for a long time for diabetes and thyroid disease development. Vaccination. The vaccine is important point for this virus because it's the best way to prevent a rubella and congenital rubella syndrome. The vaccine used today is the RA27 live attenuated vaccine, usually given as a part of MMR vaccine, which protect against the measles, mumps, or rubella. Also may be given as an MMRV, V indicate of a varicella. One dose reduce immunity about 95% of people, and the second dose protect more than 97% of the people. The first dose given in 12 to 15 months of the age, and the second dose at 4 to 6 years. Most people who get the vaccine develop lifelong immunity after the vaccination. Because this vaccine is a live native vaccine, it should not be given during pregnancy. Women who adverse to avoid becoming pregnant, women who get the vaccine avoid to become pregnant in the first months after vaccination. Vaccination maybe have some adverse reaction in some people with a severe immunodeficiency or a severe allergic to activation of the compound, and here like a great fever, mild rash, and joint pain. Biosafety and control and infection control. Rubella should be handled under biosafety level 2. Procedure that may generate aerosol. Any procedure generated aerosol should be performed inside biological safety cabinet. because the rubella is an involved virus, it is easily destroyed by alcohol, detergent, and the heat. Pregnant laboratory workers who are not immune should be avoided to handling confirmed rubella culture because of the risk of the fetus infected. In the hospital, patient who suspected or confirmed rubella should be placed under droplet precaution until 7 days after the rash began. In the case of the infant with the congenital rubella syndrome, this infant may be shedded viruses for many months, so they require contact isolation. They require to implement the contact isolation, especially during a hospital admission. A health worker should have a documented immunity through vaccination or previous immunity working in the lab for the diagnosis of rubella. This is all of the rubella. We can summarize the information in this lecture in the point of a rubella is involved positive single RNA belong to family Mantufaridia, and human is only natural reservoir. There are only one serotype, making vaccination highly effective. Rubella infection usually mild, but infection during the first pregnancy stage or first trimester of the pregnancy can cause a congenital rubella syndrome, which leading to serious birth defect. Laboratory diagnosis included assessment of IgG, IgM, IgG ability, PCR, or intervention result of all of these tests together, and depending on the timing of the sample collection. There is no specific antiviral treatment for infection, so prevention through vaccination remains the best strategy to control infection. So most important point in medical laboratory, at the medical laboratory you play essential role in diagnosing outbreak investigation, surveillance, and supporting the rubella elimination program. That is all for the lecture today. Thank you very much for your attention.